The session for January 16th is now in session. If you would please put all phones on silent ring or turn them off. Thank you. Madam Clerk, would you call the roll?
Commissioner Jones?
Here.
Commissioner Liner?
Here.
Commissioner McCabe?
Here.
Commissioner Sampson?
Here.
Commissioner Tyson?
Here.
Vice Chairman Dacey?
Here.
Chairman Mark?
Here. If we would stand for the pledge, please. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Lord, we seek blessing on the task that lie before us. Bless our deliberations with wisdom, our work with clarity and accuracy, and our decisions with impartiality. In Jesus' name we pray, amen.
Amen.
You've all had an opportunity to look over the agenda. Do I have a motion to approve the agenda?
So, second.
All in favor, say aye.
Aye.
Nays? The ayes have it. Next on the agenda is the minutes consent agenda, which consists of the tax releases and refunds. And the board tax relief funds contained in attachment 1B. I have a motion to approve. Second?
Second.
Roll call vote, please.
Commissioner Jones?
Yes.
Commissioner Liner?
Yes.
Commissioner McCabe?
Yes.
Commissioner Sampson?
Yes.
Commissioner Tyson?
Yes.
Vice Chairman Dacey?
yes,
Chairman Mark?
Yes. Next on the agenda is the East Carolina Workforce Development Update. Tammy Childers. Morning, Tammy.
Thank you for this opportunity. It's not working. I'll go ahead and get started. The Eastern Carolina Workforce Development Board is located here in New Bern. We are a regional nonprofit board and 501c3 status. We serve Carteret, Craven, Duplin, Greene, Jones, Lenoir, Onslow, and Pamlico, Wayne counties. The Workforce Development Board is the administrative entity for the Federal Workforce Innovation and Opportunity Act funds. Our budget is around $5.6 million a year. And with that money, we oversee the one-stop career centers in our region called NC Works across the region. I'm moving forward a little ahead of the PowerPoint, so I'll just give you background information. But across the region, we have 5 career centers located at the Division of Workforce Solutions offices, and 4 of them are housed by local community colleges. And here we go. Our board of directors is actually appointed by the chief elected officials, and it requires a partnership. And Commissioner Sampson serves on our consortium board representing Craven County at each of our meetings. Our board members from Craven also include Bill Green from BB&T, John Wilson from BSH Home Appliance, and Anthony Cruz representing Fleet Readiness Labor. Our board's role is to ensure that our workforce system is employer-driven. We try to do that through the oversight responsibilities that we have over the career centers to meet the needs of job seekers and employers. Our vision, of course, is that all of our employers have access to the talent they need to grow their businesses and be productive, and that job seekers can find the meaningful opportunities for employment, education, training that will result in upward mobility. Understanding our workforce trends is something that we take very seriously in all of our work. We look at, what does our economy look like from the employment trends, the unemployment trends, who's hiring in our area, who's in our workforce, what types of jobs are available, what are the workforce challenges, and how do we address the needs of business community in addressing those challenges. We also look at what programs and trends are in place to prepare the current workforce along with the future workforce in developing new programs for the emerging workforce in partnership with our colleges and school systems economic development. And then overall, we are tasked to evaluate the success of those efforts. What we're seeing, and this is something I think from last week you heard at the economic forecast that was sponsored by RSM, was that North Carolina's economy overall is continuing very strong and certainly keeping pace at the national level as well. But with those challenges, with globalization, we see that companies are still saying that they need skilled workers, that they need workers with the right set of skill set requirements in order for them to be productive and prosper and grow their businesses. We also know that in North Carolina, the realignment of resources from rural communities to urban communities certainly has to play on those investments made into our state and into our local economy through new business. This slide right here is actually dated since then. The new numbers were released in November, and it shows that unemployment has gone up for Craven, where this says October, it was 4.3. November shows that the unemployment rate has now reached 4.8. But when you look at how it was a year ago for this time for Craven County, it was 5.1. So we're still lower unemployment rates than what we were a year ago, and we're still just slightly below what the region and state level is at 4.5. The U.S. is 3.9, so higher in those areas, but as a region, 4.8, and the region was 4.9%. The jobs in our area that have the best outcome for wage opportunities are up here, and that show that the education and health science, that's where we actually spend from the workforce innovation side of the house, where we have programs that we fund and support people to go to school. Health sciences is our #1 program where we see more people enroll in training and go to work. And then followed by the trade, transportation, utilities, manufacturing, leisure and hospitality, and then professional and business services. And that's how it looks for our region, and especially here in Craven. And you can see that those trends actually are in line with what the national projections are too. For who is in our workforce, it definitely shows that our youth, the 20 through 24, are the ones that are making up a lot of our workforce. But the big challenge that we always have is how do we keep and retain those workers in this area that usually they're just starting their career, and they look for upward mobility and advancement opportunities for learning and growing, and they leave us. What we have in this county also is a higher number of retirees that make up our workforce. This is slightly above what the regional average is for who's in our workforce. For Craven County, when you look at the industry, there's 2 slides that are almost the same, but this is just to kind of show that from the regional standpoint, Wayne, Onslow, and Craven are where the majority of our workers in our region do commute to. And you can see that government is where our top employer is across the region, followed by, and then you can see the retail and accommodation, food services, health science, and construction. And looking at from a regional perspective, again, it lets you see that our government is our strongest employer for this area, and then followed by the retail and advanced manufacturing, food services, and health science. The challenges that we have in this region is being that we are predominantly a tourism area, hospitality, we don't see those wages that people need to really be self-sustaining. And looking at the workforce in Craven County, while small business does make up the majority of all of our businesses, this is important to see who we look at and target as far as potential employment. The top 25 employers that you see are the ones that typically are hiring, always looking for employees, and looking for employees especially with those skill sets that they need. And what's interesting when you look at, like, for example, #2 on that list was trade, transportation, and that does include your retail, Publix, Lowe's, et cetera. For Craven County, and we've heard this too last week, but the wages in Craven County we're fortunate in that they're slightly higher than what we see in the rest of our region. And it shows that the average earnings are $52,737, which Fleet Readiness East probably helps carry that, along with our manufacturers in healthcare. Challenges that we see and that we're looking at is when you look at this chart here, it shows how the growth is in North Carolina. It shows that up until 2012, Eastern North Carolina was keeping pace with the state and with the nation. But since that time, it could be policy changes, or whatever, incentive packages, I don't know. But you'll see that the difference in that gap is growing wider, where Eastern North Carolina is not growing as fast as the rest of the state. We're growing at a 3.5 as compared to 10.8. And this slide, the next few slides, are just to show you some wage data information and to really point out that we hear this all the time, that if we have individuals that have those skilled trade skills, that they're likely to be able to work and earn a good living. And this right here shows that for the Jacksonville-New Bern area, that proves to be true, that the wages here for the types of positions that are in demand in this region are predominantly those skilled trade along with the health science. And you can see that with the high school diploma and some work experience, it could be short-term training, could be taking a welding class, for example, along with their high school diploma, that they're likely to earn really good wages. And you can compare this with the next slide, which shows the associate degree programs and where the training offerings would result. Again, for our area, Jacksonville-New Bern area, it shows a lot of the health science type occupations and what their wage earnings are. So there's jobs in demand for our area that require some skill upgrading and require opportunities for lifelong learners and people who want to go to school. And there are resources to help people take advantage of those types of training programs. And then again, for the post-secondary, you can see that the wages are really comparable to those that just went to school for maybe 1 year and received some training. Again, showing in our area that the health science types of career paths are the ones where most people can find a job right now. And the higher the education, the higher the wages for our region. And what I also have provided that I'll give to Gwen is a copy for Craven County. It's a wage analysis that shows the different occupations and what the wages are, along with what the forecasts are for those types of positions. For the Workforce Development Board, when we're looking at the resources that we have available and targeting those resources for training, we try to set guidelines for programs that are operating through the colleges and at the career centers, that if you're going to use training dollars funded through the Workforce Innovation and Opportunity Act, that they need to be for training occupations that are in demand, that's going to result in higher wage living. And we use a lot of the data that we just showed you for the career advising piece, so that customers, when they come in and they're meeting with a career advisor, they can look and see what those potential wages are and how that will impact them in their career planning. So we look at the areas that we target, that we help support as far as training opportunities. And again, it's health science, advanced manufacturing, aviation and aerospace, distribution and logistics, the military and defense, construction, skilled trades, and tourism and hospitality. And I do want to point out that the majority of those jobs where you see the asterisk are the STEM-related type positions that our school systems, especially here in Craven, are really focusing on and trying to help shape that future workforce and having the science and math skills needed where they can be ready to take advantage of these types of training offerings. The one that we have on there that's hospitality and tourism, while it's definitely needed in our region, every employer that's a small business will tell you that they're looking for workers and they can't find workers. We oftentimes have a hard time because that keeps our wages low as far as a training opportunity, and we're trying to get people into education programs that's going to lift their upward mobility with our resources. Workforce challenges that we constantly hear is the retirees, who's going to fill those jobs, and how are we growing a pipeline of workers to help in that area for those skilled positions. Cultural and age differences, and that boils down to oftentimes we hear the lack of soft skills and the need for better communication skills, teamwork, et cetera, and being able to really communicate that to our young workforce on what's expected in those positions. The skill shortage, and how do we partner with the colleges and our school systems to make sure we're offering training programs that can address those skill needs. The learning disconnects and high school dropout rates. I think when you look at the great effort that the schools are doing, we still don't meet the mark of what we expect for high school graduation rates. And there was a report that was provided to the General Assembly that showed all of the schools' outcomes for their cohort of graduation rates. And Craven County showed 85.1%. Which is good. The state, of course, has a higher goal of seeing 87 and 90%, and it shows that we can continue, and we should continue to make investments in the classroom so that teachers have the support that they need and have teaching assistants to help prepare those workers. As far as dropout programs, we also look at, how can we get those young people that have dropped out, get them back in school and to stay on track. One program that we have through our board, it's a youth program. The funds are really directed toward out-of-school youth, 16 to 24. 75% of the budget has to be spent on those young people that have dropped out of school or those starting their career. 25% on in-school. And in our area, we have 3 in-school programs. Craven County Schools does have one of our grant programs with 54 students enrolled, and that provides remediation and work-based learning opportunities for those young people. Drug issues, we still hear from employers that the drug issues and background checks are typically one of the reasons why either a person will not be employed or the first reason why one would be dismissed. And those are some of the challenges that we see in partnerships with our colleges and schools. I would tell you that in economic development with Timothy sitting here, but every time when we do meet with employers, those are the items that come up on the list that they say that we need to collectively address. And the best part is that employers that we talk to want to be a part of a solution and are always willing to, be available for the most part to help in that way, be it touring their companies or providing job shadowing opportunities or going in and talking to classroom of students. But the real effort for that partnership on investing in our youth and growing our workforce is something I think is sincere in this county that we can be very fortunate and proud of. Some of the activities that the board is involved in, with our 9 counties, we partner with 7 community colleges. And the data that we're showing here for the schools, the community colleges, they want to make sure that when they're designing a training program, that it does have the support of industry, that they do have employers that are willing to give them input on curriculum, input on what those types of classes should look like. And that really is what the Career Pathways Initiative is all about. It's looking at regional opportunities to grow the region through partnerships and strategic investments in education and training, aligning with employers and what their workforce needs are. So with that, looking at how health science was our #1 for our area where we see predominantly the most enroll in training, and that probably would be the case throughout the region. Our colleges, along with our 9 school systems, worked with the board to get the health science career pathway certified, which is to help promote and market those opportunities to high school students. We also have worked and received certification for the advanced manufacturing pathway. So trying again to tailor the message to high school students and job seekers that if you want a future in Eastern North Carolina, look at your labor market trends, see where those job opportunities are, and then train and prepare for them. We also have, in that effort, the last time I was here to talk to you, it was about the Work Ready Community Certification, and that was a couple of years ago when Craven was like #3 at the state to become Work Ready certified. Well, today, all 9 of our counties have met that goal. of being work-ready certified. So when we look at the map that ACT has for work-ready certification for North Carolina, you'll see the whole eastern region is gold, which we're very proud of. And it's required a lot of work from our schools, from our career centers, as well as commitment from employers. How employers commit is by saying they want to support the Work Ready Community Initiative, is that they're agreeing that they do need those skill sets, that they need, education to be a priority for their community, is certainly a priority for them when they're looking at future growth and investment, and they want to be in a prosperous region. So if our citizens are prosperous with their education goals, businesses too will prosper with the workforce that they have. We also have, for the work-ready communities, our board purchases a site license, and the site license is really a pre-assessment tool that any customer could use in a career center or college or school that helps them sit down at a computer. It's a remedial tool that you can practice taking a work keys assessment prior to and spend time at home working on it if you like. But it's a real investment that we've made, we believe, in our workforce, where we have over 60,000 that's received the work-ready, the work keys assessment and certificate. We've probably had double that that's been on the website and practiced for the work keys assessment. I mentioned at the beginning, we have our career centers, 1 in each county, 5 are at Division of Workforce Solutions, 4 are at community colleges. And what's new on the horizon is the fact that we have apprenticeships and pre-apprenticeship opportunities, and there's being investments made at the federal level and at the state level to really call for employers to look to providing those opportunities to help grow and develop their own workforce through work-based learning opportunities. And the way that for the apprenticeship opportunities, being able to have employers that are willing to provide that opportunity for high school students or job seekers is another way to help grow their workforce. This pathways chart that I've just talked about really shows that it doesn't just, it's a open entry type exit where it begins early on, from education K-12, but as somebody gets out of the workforce or changes jobs or decides to go to college or moves up, at any point they can, make that career change by building on the skill sets they have and taking those types of classes that could help in stackable, portable credentials or earning toward a higher education. For our career centers, we actually, it says 38,000, but during that time period, we served 40,000 customers in our 9 counties through the career centers. And I looked at a report that was provided by Joy Hudson, and the number that actually of customers that were served here in Craven was over 5,000, 5,573. And the number of employer services that were delivered for employers was 1,818. The part about the NC Works system, this has been in operation now for the past 3 years. It's the state's labor exchange website, ncworks.gov, and it's a requirement now even for high school students to get on and register. There's plenty of resources, but definitely to be able to look and plot your career path using labor market information and wage history information and to see who's hiring, you can do that much easier now through the NC Works system. Employers can post a job, but when they post a job, it's important that they be as detailed as possible about that job description and what those duties will be, because once they post it, if it's not completed, you will end up with attracting all kinds of individuals, and it may not be the right one. So we ask that employers always be as detailed as possible when posting and listing jobs onto NC Works, and job seekers as well. We ask that they be as specific and detailed as possible. There's opportunities for them to post the resume. There's opportunities for that website to create a resume that helps them really hone in and define what those job duties were of their past employer and how to communicate that effectively in a resume. Services for employers that are available through the Career Center system are the employee recruitment and screening, the tax credit, materials on labor market and what those wages are and industry trends, workshops, seminars, and job fairs. The example, the March 20th event here in Craven for the NC Works Career Fair. Skills testing of candidates, that's the Work Keys assessment. The WIN is the software that prepares for the Work Keys. Services for employers that are looking to downsize, that would be the Rapid Response. Training services for employees, that would be on-the-job training or types of incumbent worker training programs. And then, of course, the workforce literacy training. For job seekers, there's certainly an investment being made into the career centers to make sure that career advisors have the tools and the resources and the training needed to be as effective as possible. One of the requirements that we have in our region is career advisors have to be a certified career development facilitator and go through extensive training, but really working on with customers about what their skill needs are and helping them determine where those training options would be if they're interested in going to school or to go to work, but that they have a resume. There's classes that the colleges offer through the human resource development for workplace readiness, and a lot of those classes are even offered through the Career Center as well. I mentioned the youth program already here at Craven. We have for youth services at Craven County Schools as well as in the Career Center, where young people, if they come in, if they don't have a high school diploma, meet with a career counselor, and then to help them get enrolled in a high school diploma program at Craven Community College and get the work experience needed along with some technical skills needed to gain employment. And that's pretty much it briefly. Do you have any questions?
Do any of the commissioners have any questions?
Mr. Chair.
Yes.
First, Tammy, thank you for the report. There's a couple things I want to ask about. The labor force, the senior side of it, is that full-time or is that seasonal part-time that those numbers are based on?
That I cannot tell you, but I can get that answer for you.
It's
It's just a mix.
That is a heavy load for retirees.
We
on
do
there.
have quite a few working, and I would say that the majority, I could be wrong, I would fall in that category, and I'm working full-time, but, for the most part, a lot of the seniors, especially here in Craven, we're very fortunate where they work part-time and really benefit a lot of companies. We're one of them in our area, so.
Another thing, I think the community needs to be aware, and I think this board over the years has been striving to get the workforce built up to what it should be, but we're still not there. I mean, every meeting that I've gone to, every briefing that I've heard, it's always about, we do not have the workforce to bring in larger employers because we just don't have the workforce available, either by people or by education, or meeting the requirements. So, and I think this board has gone a long way to push that, but it looks like we haven't not gotten there, and so we need to move that forward as well. Second thing, I want to make the public aware, I think this report pretty much puts us right in line at our last meeting when we passed a tall structure order supporting Cherry Point and the military bases. Based on this report, if the public can take a look at this and see this, of what the government does for this county and for this region on the workforce and the amount of money put into it, of why this board feels it's necessary to protect the mission of Cherry Point. Because as it was stated by a number of commissioners at the last meeting, this county would be hurting drastically if we lost Seymour Johnson, Cherry Point, or any of the other bases. So that's the reason why. I mean, there's a lot of workforce at all of those bases. And this helps us, I think, of why we're doing a lot of things. I mean, we know why. Now we've got other agencies and people that know why. The public needs to be aware that it's critical for this area.
What we're also trying to push exactly what you just mentioned, without our bases and the work that goes on in our military communities and for this region, we all benefit from those high wages and having a stronger economy. But we also see that as a labor force, our females that enroll in training programs, and even looking at our data, tend to enroll in training programs that are like health science or early childhood education, not as much in the manufacturing and the skilled trade, and that's where we have the greatest need. So there's an effort underway even to show those comparisons where, to train, and you may get your CNA 1 or CNA 2, which is needed in our region, but you're going to earn $10 or $11 an hour, whereas if you go to work at BSH in production, you might earn 13 or 14 starting out. So trying to show those comparison of wages and opportunities, and that's tying into how do we start reshaping and rethinking our workforce for the types of jobs in demand, and really focusing on labor market data to help drive those training offerings and agenda forward for our economy.
Again, thank you, Bill. Chair.
Commissioner Tyson?
Tammy, the disparity in the job growth between our region and the state particularly and the nation, do you have the number for Craven County and broken down out of the region that you could send us?
I can look at that and see, yes.
Do you have any idea off the top of your head?
Off the top of my head, I do not, but we have that information, so I'll be glad to get it to you.
Okay.
We also have where, and I didn't provide it, but I'll make sure I send that to Gwen as well, but shows pretty much for the wages of the folks that come into the Career Center. We don't have access to where I can pull wages, but we can access the data that pulls the data to show, but it shows the return on investment from when a customer comes in and when they receive training, how much it's getting back into the community, and then it breaks it down, like for Craven, to each of the zip codes, so you can see broader based who's in training and or who's in your workforce and what their wage earnings are bringing into your economy. So I'll get that to you.
The job growth disparity in this region, which is 9 counties, most of them rural to some extent, a lot of agricultural. The state is aware of the disparity. I'm sure the federal government should be aware of the disparity. Are there any reasons other than lack of workforce that you could, or is it infrastructure that keeps
I think a
this
lot
disparity?
of it is. It's kind of combined with the infrastructure, with the technology, the broadband, tax incentives or employer incentive packages. But something happened in 2012. Number one, there was a new governor, but I don't know what that shift was that caused it to change. But we experienced it here, where you're just not seeing that growth as high as
Well,
the
I
rest of
have
the
to
state.
suspect that some of it was
Policy.
the economic development grants and so forth. I think 85% of the state economic development grants during this time frame went to Mecklenburg and Wake counties. And certainly that's, I'm hoping being addressed by the General Assembly this time.
That's what, yeah.
Do you think?
Yeah.
Timothy, you're grinning, but, I mean, it should almost, to me, be the other way around. It
That's
should
why we
be-
put that slide in there, but it really did show a great difference for this region and where the needs are.
Okay, I'd appreciate it if you could get me the Craven numbers.
Well,
Thank you.
Commissioner Jones?
One question here. You had stated that you gave us in your slides the unemployment rate for October 2017, and then you made mention that for Craven County for November of 2017, we went to 4.8% from 4.3. Do you have any explanation of knowing why that is increasing? Is it increasing also in adjoining counties?
it did. It slightly went up across the board, and typically, no, I do not have that.
When would you find out about December's numbers?
Those rates won't be available until sometime next month. But I'm providing for Gwen our newsletter, which on the back page has the new numbers that was just released. So we'll be able to share that.
Okay, thank you.
Still greater, I guess, lower than what we were a year ago, so that's good.
Commissioner Sampson?
Mr. Chairman, one step we made a long time ago when we brought the counties together to work together. This has helped a great deal when you find people working together to make things better for each county rather than trying to do it alone. Another thing that has happened is we began to organize and get the business people working to help us to create business that they need and that they can employ people with. And I found a long time ago that it's a blessing to have people working together on the same cause rather than have people fighting each other. And another thing that has happened why we haven't grown as well as we thought we should is because of the infrastructure. Now, like Charlotte and Mecklenburg County and Raleigh and Durham, they have the infrastructure. We just began to get infrastructure in our 9 county areas, somewhat infrastructure, not as much, because business not coming unless you have the highways and the bridges that they can get their material in and out, even into other countries. Airports, and we had airport a good while, and our airport is growing. So we had to look at all these type of situations why we are not going as fast as we could, but I think we're doing a whole lot better than we was doing. I remember when our Eastern Workforce first began and had to struggle for a while, and then we began to come together in other counties. Well, some of the counties poorer than we are, but working together makes it better because it's less pressure on us to have to help the other counties. So I think this workforce development has done an outstanding job in working even harder, even with our reentry council. We're hoping that we'll be sending people to get upgraded in their education, that they can make a difference, because we have spent quite a bit of money in our county to subsidize these people that don't have any jobs. And we find these people, because of records, even if they have training, if you got something on your record, you can't find a job around here. Very few people that has a record can find a decent job, even if they're qualified. So we need to work in this area too. We have to do something too, because we can't put all the pressure on one body of organizations when we have to do some things to work together in our own counties that we can make these things possible. So I would be really enthusiastic for we continue to work hard to see that people get training, this type of training that they need for these different jobs that is available. Just like I remember when I was going to school, a lot of kids were going to college, and when they get out of college, wouldn't even be no job there. They was training for the wrong thing. We have to be sure we train people for jobs that are available. And I think our schools and our workforce development is really working hard to do a grand job.
Thank you.
Let's think about when you're working with, I'd say, these counties, different counties, to create jobs and create togetherness and to create salaries. It's not easy. And then you got to deal with the state government, you got to deal with the federal government. And then you're on another level then. So we need to do everything we can to help workforce development, that they can do the best job possible, and all these other things that we need to do, such as this infrastructure. And we know infrastructure even worse now since we had this ice storm. I tell you, I don't know If it wasn't for the Lord, I don't know what we would do. But I'm really enthused of the report that we have here, how we are moving forward, not backwards.
I would just want to point out that for the Federal Workforce Innovation and Opportunity Funds that serve low-income adults, dislocated workers, disadvantaged youth, Craven County has more people enrolled in the community college through the WIOA than our other counties. So that's really great. About 150 are enrolled in training right now. And for Craven Outcomes, the #1 program that really surprised us, but has done extremely well with training individuals with barriers to employment, as well as providing upward mobility. A couple of years ago, Craven Community College started a truck driving program. And from our review of the outcomes for those that have enrolled in training, it's been like 97% have entered employment in a training-related field in the truck driving industry. So they've been one that's now kind of leading, and our other colleges are trying to join on board as well. But Craven has done a great job with training.
Scott, Scott, do you have anything that you want to ask?
No, I'm good. Thank you very much. It was a very good presentation.
Thank you. Mr. Sampson, did you have something?
No, that's it.
Okay. Thank you very much.
Thank you very much.
Next on the agenda is Lou Cannon, partner in RSM, will present the board 2017 audit report for the year ending June 30th, 2017.
Good morning.
Good morning.
One slide that Tammy left out is the one that shows that the Eastern Carolina Workforce Development Board is recognized both statewide, regionally, and nationally for how well it's run. So I'd like to throw that in.
Thank you.
All right, we're here to talk about the results of the audit for the fiscal year ending June 30, 2017. I'm going to go over the results as I usually do and not, wade through a lot of numbers. Anytime you have a question, please feel free to stop me. I think you all are either have or will be getting a copy of what's called the CAFR, the Comprehensive Annual Financial Report for the county.
We all got it.
Okay, it goes far beyond just what a set of financial statements has. It has statistical data, it has a compliance section, it has a management's discussion and analysis, which is a sort of a synopsis of what's gone on for the year, and it's broken down in sections. And we own 3 pages in that section related to the financial statements. And that is our opinion on your financial statements. And basically, you can get one of 4 types of opinions. If we don't think your financial statements are fairly stated, we would render an adverse opinion. If something was so contingent that we couldn't render an opinion, we would disclaim. If we felt that they were fairly stated except for a particular item, we would qualify our opinion and say that except for that item and identify it. Then there's what's called an unmodified, that is without qualification, generally called a clean opinion. It's the highest level of assurance that we can give as auditors, and you do receive a clean opinion on your financial statements. That's what every regulatory body, bond rating agency, that's what everybody's looking for to see the accuracy and comprehensive nature of your financial information produced. We like to give a little context. We go through the general fund, which is really the fund that you have the most flexibility with. You have capital project funds, special revenue funds, but they're dedicated to particular purposes. And this just breaks down by broad category where your general fund revenues come from. And you can easily see that property tax approaches 48% of your revenue, sales tax about 15%, intergovernmental, which includes grants from the state and other entities, and then charges for services. And it's, as far as what's generated here, sales tax and property tax, far exceed everything else. And this puts it in a bar chart so that you don't look at it in just 1 year alone. And you can see that the first bar, the blue bar, which is property taxes, up about 3 million from the prior year. Actually, a couple of things went on there. The valuation literally went down, but the rate went up. So overall, there was a net increase. And everything else, as far as other taxes, very similar. Sales tax was up a little bit. All right, the tax rate. And what we have here is a comparison, the most recent data in those two bars on the right. The middle one is for the similar sized counties, and then statewide. It's a year old, but these numbers really don't change. When you're talking about 100 counties or similar size, you're grouped with about 27. So those really don't change much, and you can see that your 0.539 tax rate is lower. It has been lower for a number of years. This comparison, if you go back year by year, would look very much like this. And as far as the next slide, your collection rate was about 99.4%, and you can see where that rate has been gradually going up. You're at the very top end, so it gets harder and harder to move that percentage, but you have certainly been up and over 99% for several years. This shows the property tax collected compared to similar sized counties and again to statewide. So the scale used makes the disparity look a little wider because your collection rate is 99.36, similar size 99.17. So they're tight, but you're ahead of those your size, and you're certainly ahead of statewide collection rate. So that sort of covers inflow. The next chart breaks down by where the money gets spent. And you can see that education getting over 25% and social services approaching 25% are the two big areas. And again, this breakdown, the percentages really do not change very much at all from year to year. And here by major segment, you can see going back year by year to get a feel for, which areas are going up. You can see that social services are flat for a number of years. Health, also the same. Education is up some, and public safety is up some. The fund balance of the county general fund is $35.9 million. The big question is, how much is the right amount, because you're levying taxes to accumulate that, but that is also where money is stored for future use. So you have a long-term plan, and money is in there and accumulating for those plans. So having fund balance is prudent, and it's looking forward to things that are going to be happening in the future. there are some restrictions on fund balance and its use that came into being back in the Depression days when a number of local governments were basically bankrupt. And basically what it says is that you can appropriate your fund balance to the extent you have cash in hand, less enough to pay your liabilities, and deferred revenues that have been received before they're earned, and encumbrances, things that have been ordered but not yet received. So when you go through that computation, there is an amount of your fund balance, in this case, 7.8 million, that, you know, as of the year end, could not be by statute appropriated, but does leave you with unassigned of 29,900,000. Yes.
Yes.
Can we go over that again, just so the general public is aware? Because I know the only thing they're gonna hear is the 35.9. Let's make sure we understand that $7.9 million of that, we have no control over. We have control over, but we're restricted by the state on
By
how we
statute.
can use it. The 27 is what the county manager and this board can use for emergencies if we need to. I just want to make sure the public is aware. We do not have almost $36 billion that we can obligate and put out there. 8 point of that is restricted, that we have to make that aside for.
That's correct.
Because they're only going to hear that $36 million.
But the 27 is a good figure.
It's a good figure.
It
A
is.
good figure.
And which leads us to, you know, how much is enough, so you don't operate in a vacuum. There are 100 counties. So again, you look at it in terms of two different things. One is your expenditures for the upcoming year, and Craven, as a percentage of the upcoming year's budget, has about 27 million, or 27% of the expenditures in fund, encompassed in fund balance. Similar size counties in North Carolina, again, this is a group of 27 counties, have 26.75. So it's very close. And across the state, for all counties, is 28.26, which says that there are 100 counties, and they each have a board going through the same deliberations that you do. You know, how much is enough to do what needs doing, not be too little, and they're all really getting to pretty close to the same conclusion. You hear many times there's an 8% number thrown around, and I'd like to point out that that's a minimum. That's based on a study done by the Government Finance Officers Association many years ago about what is the minimum. If you are down around that 8%, if you go under it, you're going to get letters asking about your cash flow needs, and if you have enough built up.
This also helps us with our ratings as far as borrowing money also.
Absolutely, absolutely. All right, that's a quick sort of review of the operations. I would like to also go through for just a minute. We audit under 4 sets of standards. Our regular professional standards, generally accepted auditing standards. Because you're a government, we audit under government auditing standards. Because you receive federal grants, the Single Audit Act is applicable. And the state of North Carolina has their own version for state grants, the State Single Audit Implementation Act. So there is a wealth of testing that we're required to do, and we are required to identify what are deemed to be major programs and test those. And we are required to render an opinion on your compliance with laws and regulations that attach to those. And actually this year, the North Carolina State Auditor required that we expand what we've done, particularly in the Medicaid area, as they look at that statewide. So we have findings that came to light, and they're very detailed findings. I will sort of group them, but again, I want to bring you back to the gist of it is you receive clean opinions on your compliance with both federal and state regulations, because we have, there are 3 additional reports in the compliance section that speak to that. And, but I did want to bring the Medicaid testing, which the state auditor required us to significantly expand. And I'll just say this, the expansion of work required is such that there are still, as of just a few days ago, there are 30 counties whose audits have not been submitted to the state treasurer. So, there was a lot more work required. And we did, we had findings, and there were, related to Medicaid, there were 8, and it's very detailed testing. I mean, it can be, we're doing a sample that looks at particular forms, if they're in there. And we, we determine if eligibility is supported. And we did find question costs. There were about $2,000 of question costs. Now, this is in terms of, there was approximately $50 million of Medicaid spent, those benefits spent in this county. And that's just the federal portion. And then you have the matching state portion. So the total is approximately, I think, $74 million. The number is there's a schedule in the compliance section, the schedule of expenditures and federal and state awards that shows those direct payments. But, so $2,000 is very low, and the error rate we sort of put together in looking at the results was 2% or less. And what had piqued the state auditor's concern was she did a study of like 5 to 7 counties ranging from small to large and found error rates anywhere from 5 to 20%. And if you're talking about, just here, if it's $50 million, if times 100 counties, that can add up to a lot of money. But $2,000 is very small. If you project that onto the entire population of dollars spent, it blows up to $200,000. That doesn't mean anybody's going to ask for that money. It's just, for those items we looked at, all the substantiation needed was not there. It doesn't mean anybody necessarily received benefits that they should not have. It's just there was a lack of documentation in all instances. So we couldn't find it from that methodology or an alternative way of finding it out. So anyway, the $2,000 is really what you'll hear about from the state. And we'll have to wait until all the audits are in to see statewide what that means. But I do know for a fact that your error rate will hold up with anybody in the state.
Mr. Chairman, before he move, are you moving on to another subject beyond Medicaid?
Correct.
Could I ask a question on that? So you said there was 2,000 out of approximately, this was just a state portion. You didn't, or did you look at state and federal?
Yeah, they're together, and I'll
Okay.
give you the
So-
exact, I'll give
No,
you
you don't need to do that, but,
Okay.
you said 200,000 on, at one time, so it's 2,000 is the
the
amount.
actual dollars. When you project that, the likely error, when you project
Okay,
it
so
to
you
the
did a
entire
sample.
population.
You
That's
did
right.
a sampling,
Absolutely.
and that if you projected that sampling throughout the whole base, then you could be looking at 200,000.
That's correct.
Okay. Did the sampling show any that, well, I guess you wouldn't have that, maybe claims that were denied, Medicaid claims that were denied that might have been eligible, you wouldn't know that, though, would
Claims denied that should have been.
You don't
We're
look at
looking
every,
for,
you just look at money paid out, is that right?
no, we're looking at applications.
Application,
So it needs to be, correctly administered, whether
Right.
you're denied or accepted accurately.
okay. And that audit is part of this audit, or did
Yes.
you have a separate audit?
No, it's in
CSS?
here.
Okay.
So anyway, it shows up that there are more findings this year because of the additional work and the depth of the testing. However, again, I think the error rate will hold up with any other county.
And this is the first time that I remember you going over this individually Medicaid findings with this board. Is that because there's more, another requirement from the state auditor that you look more deeply into Medicaid?
Right. You know, we did have question calls, we do project those, but mainly, I wanted to focus on it because there are a number of findings. I think there are 8 findings, but they're all about eligibility. So I don't want to make it any more or any less than it is, and want you to understand that it's driven by the state auditor, who has to report to the legislature and is trying to gather information to do that. She can't be in all 100 counties, so part of that is pushed down to us.
Did you make any recommendations, or just the applications weren't done correctly, weren't
No,
processed correctly? Did you?
Well, in some instances where it's just not there, that's all we can say. It's an administrative oversight. But management does have a response in here. It's included as to, what their plan is to correct that.
Okay, and we don't know that the 200,000 or the 2,000, I mean, that the people weren't eligible to get it. You just know that the paperwork wasn't correctly processed. Is that what you're saying?
Right, it may be.
There's no, you're not suggesting fraud?
No,
Okay.
no. No, it's just
That
that
answers the question.
there was not enough information for us to make the call as to whether or not we're
They
eligible.
were or were not?
So, we have to question that cost. All right.
Mr. Chairman?
Yes.
Thank you. I guess, would there be an example that you might be able to share with the board as to how this shortcoming might have manifested itself? Can you give us an example?
The file for everybody who applies for Medicaid services has to have a number of specific forms and that speak to when they are initially certified or periodically recertified. And if you're above certain income thresholds or personal circumstances that are required for qualification for the services, if forms are not in the file to document that each of those requirements was considered, and we couldn't find any other alternative information, then, the assumption is not documented, not done, which the form's not in the file, and it needs to be there, and it raises the question. So that, I guess, would be one example of, where we would come up with a question cost.
And you are able to assess a financial impact by virtue of that single form not being made available.
Right. There are many forms that we have to look at. And so it's, I'm just using that to be brief. But there are, if it's not there and we can't find it from another source, then we have to question the cost because there's nothing that documents that the person actually qualified.
Mr. Chairman, I don't mean to be difficult here, but it just seems as though, so effectively what you're saying here is that we've done a sampling, and within that sampling we've identified $2,000 of of quantifiable errors. And we believe that that sampling represents approximately 1% of the overall usage of the program. And so to extrapolate that 1% finding that we've had throughout the program, we could say that approximately $200,000 of problems exist. Is that an accurate way of looking at it?
Yes, with the correction that actually the error rate was about 2%, but you're exactly right. The $2,000 of actual question costs, when projected onto the population of the dollars, the relevant dollars spent, there is what's called a likely error or a projection of $200,000.
Okay, and can you tell us approximately what the gross amount of expenditure is for our Medicaid program within Craven County on an annualized basis?
I can. And it is medical assistance, $75 million of federal money and $40 million of state.
What page is that on?
That's on page 215, in the middle of the page.
So of $115 million of outflow, we believe that there's approximately $200,000 of that might be in error.
Correct.
But either my math's wrong or yours, because that's way less than 2%.
That's because the dollars it's applied to are what's called non-magi. There's a different category. They've changed how the process is done. So we didn't look at all of it. So they're only a percentage of it.
I would imagine what you're looking at is individual filers and the percentage of problems that are associated with individual filers, rather than the gross amount of payments each recipient might have, or the total number of recipients would have gathered.
Well, again, it's a little complicated, and there are different groupings. There are different ways that the state assesses the recipients. And we looked at a large number, but not all of those. And that's why the math doesn't work, as you point out. But so it's a subset of the total dollar spent. But I think the question was, how much is spent in Craven County? And it's $75 million approximately federal dollars and about $40 million state.
Thank you very much, sir.
Certainly. We had one other finding I'd like to make mention of, and I think probably everybody's heard about the unfortunate circumstances in Wake County at their Register of Deeds office. That was an area we targeted this year, and so we were, the people in the Register of Deeds office were enthusiastic about our, going over and above. We try to put something new and different in every year. So this was, Register of Deeds was this year. So they were helpful, they were open. We found some items that can be improved as far as their controls, and they have set about making those changes. Now, we didn't find anything that had been done improper, but there were some controls that needed to be enhanced, and there's a finding in there about that. That's sort of a financial statement finding as opposed to compliance. Any other questions? I would like to recognize Michelle Kiefer and William Alexander, who were on the engagement team with me, and they worked hard. We appreciate all the work done by all the departments here. It's obvious that we're we bring the fun to everybody. And we appreciate it. It's a team effort. We have to have their help to get it done in a timely manner.
Okay, thank you. Any other questions?
I would,
Commissioner Jones?
Mr. Chairman, when will the state order to release the findings for Medicaid across the state, the error rates? When could we expect them to know?
I'm not sure, because as I said, just a few days ago, 30 counties had still not submitted their audits. I mean, yours has long since been submitted, but there are a number, and probably they will have to get almost all of those in before they come out with, some kind of report. There are generally one or two across the state that drag badly each year, but there's still a lot that they need to get in the house before they start compiling totals and get to final answers. And that will indeed drive the testing from here on out.
Based on everything that you have said, it would seem to me that we have a fairly clean report.
True. Clean opinions, financial statements on compliance. Was there a new wrinkle with Medicaid? Yes, but the actual question costs were only $2,000. So while, there are controls and there are some things that can be tightened up, and DSS is looking at that and taking care of it, yes, I would say that's clean.
I want to thank you for your report. I also would like to congratulate our staff, our county manager and finance officer, for the work that they did.
Absolutely. Thank you very much.
Thank you. Okay, next on the agenda is Department Matters, Health Department Budget Amendment. Scott Harrelson, Health Director.
Good morning, gentlemen.
Good morning.
The first agenda item was a requested budget amendment of $220,000 for our hospice program. And the reason being is because the amount of services rendered have increased. We have consistently been above a patient census of 30. And when you look at the cost associated with the program, staff is number one, then prescription drug costs comes in next, and then supplies after that. So due to the increase in patient volume, we have increased revenues greatly. Last year, we had less than $30,000 in profit. Year before that, about 160. And if we continue on pace this year, it'll be more like 500,000. So I say that to say that we can cover these costs and still have a pretty good profit margin at the end of the year. And at this point, I'll entertain any questions you may have.
Well, first, let's get a motion.
So moved.
Second. All right, discussion. Any questions?
Mr. Chairman, Scott?
Yes, sir.
Medicare is up quite substantially, and what do you attribute that to?
Increase in patients. I think that,
Why increase in the clinic or in the, what part?
well, in the number of hospice patients served.
Okay, hospice patients.
Yes, sir.
Okay.
We've gone from what used to be about 14 or 15, and now our average patient census is somewhere around 35. And it's just amazing just how much more, because you have a daily rate of about $140 coming in from Medicare. So, and our staffing complement right now is a nurse supervisor, 4 nurses and 4 nurses aides. We have of course, Thomas Smith is our director, and then we have a lot of assistance from our volunteers and a volunteer coordinator, a social worker, and a chaplain. And I think that the percent of hospice deaths served in this area is still low compared to other counties our size. So there's still room for growth. And I think that over the next year or so, especially with the new cancer center coming online and the palliative care that they're doing at the hospital, I would imagine you see more people, not only our agency, but all of them. Hopefully more deaths served by hospice in the area, and we can maybe get up to more of the state average for folks our size, counties our size.
Mr. Chairman,
Yes.
question. So Scott, you're asking this board to approve 220,000
Yes, sir.
to your existing budget,
Yes, sir.
which you think you're gonna more than exceed by the year end for your revenue coming in.
Yes, sir. I think that we could look at a profit margin of over 20%, which is excellent for a hospice agency. Even for for-profit agencies, usually about 15, not-for-profits usually less than 4. So, yes, sir, I think that we would be fine financially.
Thank you, sir.
Okay. Any other questions? All right, roll call vote, please.
Commissioner Jones?
Yes.
Commissioner Reiner?
Yes.
Commissioner McCabe?
Yes.
Commissioner Sampson?
Yes.
Commissioner Tyson?
Yes.
Vice Chairman Dacy?
Yes.
Chairman Mark?
Yes.
Thank you
Next.
very much. Appreciate that. Next, I would like to introduce, I'm glad that she's able to be here today, Dr. Elizabeth Swice-Good. She is our dentist on our mobile dental unit, a graduate of Chapel Hill Dental School. And she's actually going to be handling the lion's share of the presentation this morning, but I wanted to, what we're here for today is two-part on the action items, to gain approval to sell our current mobile unit to another health department. Our used mobile unit's about 20 years old, and then to be able to purchase or go out for, put an RFP out to gain a new mobile unit for years to come. And I would like to introduce you now to Dr. Swice-Good.
Good morning.
Good morning.
Thank you for having me this morning. Today I'd like to tell you a little bit about the Smilemobile, what we do, where we've been, and what our vision is for the future. So let's start with a couple of statistics. Pediatric dental disease is actually the #1 chronic childhood disease in America. With kindergartners, we see about 40% of children coming in with dental disease or a history of it. 1 in 5 children in our country will go without dental care. We actually see children with poor dental health missing school time because of dental pain. And a lot of times that dental pain causes them to seek care in an urgent care or an emergency room, and that costs a lot of money. In 2010, there was $2 billion spent in addressing dental pain in the emergency room. And we know that when patients go to the emergency room for dental care, they're getting some sort of pain management before to wait for them to get to a dentist and actually address the real issue. So lack of dental care for children leads to problems well into adulthood. Here's a quote from the North Carolina Oral Health Foundation. It says, "The lack of access to pediatric dental care creates a set of health disparities that impede wellness throughout adulthood. As a result, a significant burden is placed on local communities, exacerbating poverty, increasing long-term health consequences, decreasing workforce productivity, and draining significant personal and governmental financial resources." So we know that access to dental care is very important, and without it, our community could feel the negative effects in both the long term and the short term. But Craven County should be proud because Craven County has a solution. For the last 20 years, Craven County's been providing dental care to their children through the Smilemobile. This picture is the picture of the trailer that we currently have that we, Craven County purchased in 1998. So what do? We travel to schools throughout 3 different counties, Craven, Jones, and Pamlico, and we serve elementary schools. We see 17 schools in Craven County, 5 in Jones, and 6 in Pimlico. Last fiscal year, we saw over 1,800 patients with over 2,300 dental visits. So we're busy. And we serve schools in each district and county. We provide preventative and restorative services. These numbers listed are numbers from the last fiscal year. We did over 1,500 cleanings. I do x-rays, fluoride, and dental exams on every child that we see. And then we address their issues, the preventative services, the cleanings, the x-rays, and also we do sealants to help prevent cavities. We do fillings, stainless steel crowns, extractions, and we do a lot of oral health education. We send home information to parents. We try to communicate with parents when they come with their children if we can, and we teach these kids how important it is to take care of themselves and take care of their teeth. So because of these services that we provide, our community benefits. We have an opportunity for children to have a dental home by the age of 1, which is recommended by the American Dental Association. They have access to dental care throughout the county. So because we're mobile, we travel to Vanceboro, we travel to Cove City, we travel to Harlow, so we're all around. So you don't have to necessarily, parents don't have to get in the car and figure out how they're gonna get to us. We're going to the children. We have dental care for preschoolers in the Head Start centers. So we go into the Head Start centers and we see children, and we will either get them onto the Smile-Mobile for their dental treatment if necessary, or we will refer them to the pediatric dentist if needed. But within their school, while they're at school, they get their teeth cleaned, they get a dental exam, and they get a fluoride treatment. We see a very decrease in decay rate with the children that are regulars on the Smile-Mobile. It's very surprising to me when I first started, the difference in a first-time patient on the Smile-Mobile and a child who's been coming for a few years. The first-time children normally are coming back multiple times to address some dental decay that they may have. But a lot of times we are thrilled to see our returning patients come back and they don't have any cavities and their teeth look pretty clean. They're learning how to take care of themselves and how to prevent those cavities. We also see patients by appointment. Because we go to the school doesn't mean that we only see the school children. We also take appointments. So our patients can call us and they can find out where we are, and if they're in pain or if they need us, they can travel to us with same-day services. So we'll make an appointment for them, whether it's during school, whether it's after school. We try to get anybody in that we need to. If they need us, we are available. We also, so like I just said, we see children outside of the school. So if we are at Bangert, we're at Bangert right now. You do not have to be a student at Bangert to be seen on the Smile-Mobile. You just call us, schedule an appointment, and we tell you what school we're at, and then parents can bring them to us. We serve the Medicaid, North Carolina Health Choice, and uninsured children. We see children ages 1 to 20. That is probably 90% of our patient population, if not more. We also see pregnant women that get a referral to us from the health department. Like I already said, we do travel, we're mobile, so we go to remote locations. This helps with parents who may not have access to transportation. So if they can't get to town, their child can still have a dentist and be seen at their school. So what we do is we go into the school office, and the child gets called up to the office, and we walk them out to the Smile-Mobile, and it's just like they're going to the dentist. They come in, they get their teeth cleaned, they get their x-rays taken, their exam, and then they go back to school. And then if we have found that they need any other treatment, we do the same thing. We go in, we pull them from class, they go out to the Smile-Mobile, get their work done, and then they return to class. So our goal is to fill a gap. Our goal is to not take away from anybody else, who might be serving these children, but we have found that there is a gap. We are one of 3 providers available to Medicaid kids in our county. So there are only 2 other dentists who are accepting new patients in Craven County, and those are for children. We do not see children who already have a dentist. Our office manager is, she works really hard to make sure that if a child already has x-rays, then we'll send a note home and say, I'm sorry, it looks like your child already has a dentist. Please continue to see your dental home. So we are not there to take away from anybody, but we just want to make sure that the children who may not otherwise receive dental care are able to get it through the Smile Mobile.
Mr. Chair, what about if it's kid out of town and moved to this area? What happens then?
So what we do is every child in the school gets a sheet that goes home. It says the Smile Mobile is coming to your school, and it has a little blurb about what we do. And then the parent is to fill out some basic information, their address, date of birth, if they have Medicaid, what that number is, and whether or not they would like for us to be their dentist and to see their child. If they meet the criteria of they have the insurance and they don't have another dentist, they don't have history, we can look up in the NC tracks to see, oh, they had x-rays 3 months ago, they must have been somewhere. We'll communicate that with the parent and make sure that they still have a dentist, that they haven't moved. But then once we receive that paperwork back, then we can proceed with seeing the children. So every student in the school has the opportunity to come see us.
Okay.
If they don't have, so everyone gets the paperwork. If they return the paperwork, if they don't have the Medicaid or Health Choice insurance, then we send a note home with the sliding scale fee information and let them know how much it would be out of pocket for them
Thank
to
you.
pay. So you may be thinking, well, this sounds great, but how are we paying for this? There's no county or state money used in the yearly budget. We file Medicaid and Health Choice insurance, and that is how we fund ourselves for what we do. We also see on the sliding scale fee, as I just spoke to, 60%. We get a Medicaid cost settlement at the end of each year. So our program is profitable, making about $78,000 a year, and we set aside a portion of that into a dental fund balance. So we have a dilemma. Our 20-year-old trailer is starting to show its age. There are some critical components that are not being supported by the manufacturer anymore. They're beyond repair because they're old and they're not making those parts anymore. And it can also be very expensive to replace these. So our compressor, our suction, and our dental units are all original to the trailer. So they're all 20 years old, which in terms of how technology has come in the past 20 years, you can imagine they're a little bit outdated. And so we are looking to purchase a new trailer. We would like to purchase a new unit so that we can continue this service. We believe with a new trailer, we will be able to serve our patients even better. And how we can do that, we'll have 3 chairs to improve efficiency. Right now, we have 2 chairs that we use for cleanings and fillings, restorative treatment, and 1 chair for an x-ray. This trailer that we're looking at would have 3 chairs, so we'd be able to increase our production, be able to see more kids in less time. And we also would be able to get some new x-ray equipment. I don't know if, when you go to the dentist, if they have the x-ray head that's attached to the wall. That's what we currently have. But there is a new product out that's been out for about 5 years and had some really great studies done on it. It's a handheld unit, an x-ray unit. It actually decreases the radiation. And so that soon will be standard of care because the radiation amount is much less. We'll also be able to do some nitrous oxide. We're hoping to implement that onto the new trailer. A lot of times with these little ones, especially like kindergartners, when they get up on the Smile-Mobile, they're a little nervous. You know, mom or dad's not there, they're by themselves, and we try to make it really fun. But when it comes to getting a filling, sometimes they're a little nervous. And that nitrous oxide would just be able to help them calm down a little bit, help us to be able to do a little bit more, and help us to refer out less. Because unfortunately, what we see when we refer patients out, a lot of times when we return to the school the next school year, there's not a great rate of children being taken to the dentist from that referral source.
Mr. Chair, you do have to get approval from the parents before the children go into that dentist, mobile?
Yes, sir. So we have a consent form that has to be filled out, a health history form that has to be filled out. So there's a packet that they get that has to be filled
Okay.
out. And it's just like if you went into the dentist and they give you a packet to fill out, it's the same thing, except they're just getting theirs sent home in a school folder.
Okay. Thank you.
Sure. And so we think we would see continued dental care without downtime for replacement of parts. We've sent the trailer up a few times to have some repairs done, some refurbishments, been able to add a Panorex machine about 5 years ago, which has been great. But if we wait until things start really falling apart and don't work anymore, then we're gonna see a very large amount of downtime that we wouldn't be able to see our patients, because we'd either be waiting for major repairs done, having to send the trailer up to Ohio for that, or waiting for a new trailer to be built out. We would like to see a delivery date for August, because our summer months are slower. We do see patients in the summer, but we do it by appointment only, because school's not in session. And so with only appointments, we're not seeing as many patients. And so if we can get the trailer in August, we'll give IT some time to get up there, get our computers going, get us trained on all of our equipment. Then once school starts, August 25th, we'll be ready to hit the ground running. And that way we won't be losing a lot of time for having to wait for our new trailer. So that's why we're coming to you now, because we'd like to go ahead and get the ball rolling on this so we don't miss out on large production months, because September, October, November, those are some of our biggest months where we're doing the most dentistry. So I will turn it over back to Scott. He's gonna tell you kind of how we can make this work in terms of logistics and more details on that.
Thank you, Dr. Swanson.
Thank you.
Sure.
When I first brought this to county manager, and we got together and discussed it with the county management team, and logistically, it would have been best for us to, instead of trying to put the unit on consignment, to put it out to the other counties and see if anybody was interested in purchasing. And we did get interest from Martin Terrell, Washington District Health Department, just north of us. They would very much like to have this program, and they don't want to expend $500,000 for a new unit. They would have to upfit and do some work on our unit. We would be transferring pieces of equipment over, like the Panorex and some other things that we have that are in good condition. But they have made an offer of $100,000 for our 20-year-old unit. And rather than putting needed repairs here shortly, somewhere around the neighborhood of $40,000, the timing would be right. And also for the August timeframe for the school year, they would really like to have their hookups and their units in place for their 3 counties as well. So all of that would bring probably a price tag of $400,000 or less. And we have been setting aside somewhere on average for the past 8 years of about $78,000. So when you do the math, this unit could probably replace itself about every 5 years if you were to get $100,000 for your previous unit. And life on this past one was about 20 years. So are there any other questions that we could answer?
Any questions?
I'd just like to make one comment. I truly realize that the county manager has great staff. But if you have never been out to this trailer and visited this trailer, that young doctor right there and her staff
That's
and
right.
those kids are just unbelievable. I wouldn't have that job in the world, but those kids love her.
They love her.
They really do. I was surprised we had this when I joined this board, but going out there and visiting and everything else, we've got it, and we're moving forward. If I didn't think she was gonna be here, I'd have real questions about this going forward.
So I'm hoping she'll stay now
Right.
for a long time.
But if you have not visited or been out there and watched them process during a school session,
Nice.
it's amazing. And I appreciate everything you do out there. Thank you.
Good job.
Mr. Chairman,
Yes.
I remember when, I first came on the board, we talked about getting this trailer. And I know when I was a child, I was not able to go to a dentist, so I had to stay home and suffer. So I know how it is with kids suffering with the toothache. And I made up my mind that I would do everything I could to help some other kids, that they wouldn't have to experience the same pain that I had. I had to suffer for years because I could not be able to afford, nor my parents be able to afford a dentist. And I know how bad it is when a kid needs to go to the dentist and he's hurting so, he or she is hurting so bad. Now, she said that trailer is about 20 years old. 20 years old. Well, I've been here on this board about 21, so I know how long it's been setting up there. And I know how much work they have done to make a difference in kids' lives. And it's well worth the price. Because when you got pain, you don't care how much money is spent on it. If you have it, you'll spend it. But if you don't have it, you're in trouble. So I'd just like to make a motion that we go ahead and purchase this trailer.
I'll second that motion.
Mr. Chairman, may I make a
Yes.
comment? I think what we, Ms. Sampson, I think you're getting to where what we're looking to do today. I don't think Scott said it. So because of the cost of the unit being over, I think it's over 300,000, that sets up a more formal process for procurement. We will need to issue an RFP for this, which is prepared. Dr. Slicegood, I think, reviewed it late last week, and it should be ready now. So we'd like to get that out today or tomorrow if possible. And we need to bring those results back to the board for formal approval once the bids have came in. We've got some very specific criteria as she went through that drawing that we're looking for in this unit, which we think we've detailed enough. That there are, however, 3 to 5 people who can build a unit like this. So we'd like to see those. And also, just in case something happens, we want the approval to negotiate the sale of the existing unit, not to actually sell it today, till we're certain on the other side, if that's okay with the board.
Okay.
I withdraw the motion.
Okay.
I draw my second.
All right, I would just like to say that there's one other advantage from the children receiving dental care is also the fact that you probably, during those examinations, find other illnesses that they were not aware of or their family was not aware of. And I think that's another important factor for these children. What kind of a motion would you like, sir?
We need a motion to authorize the county manager to negotiate the sale of the existing mobile dental unit, and a motion, it could be the same one, to authorize county staff to issue an RFP for the new unit.
Okay,
So move.
Second that motion.
okay. All those in favor say aye.
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 Nays? The ayes have it.
Thank you so much, gentlemen, and thank you to county management staff for the logistics on this.
Thank you.
thing.
Good work,
Thank you.
Scott.
Thank you. Human Resources, setting the starting salary of the sheriff, Amber Parker.
Good morning, Commissioners.
Good
I'm
morning.
here this morning to request the board set the starting salary for the position of sheriff in connection with the 2018 election. The proposed starting salary for the sheriff position is $76,665, and I've included a resolution draft along with the proposed notice of adjustment in salary in your packets. Following the election, and after the successful candidate takes office, the Commissioners retain the right to adjust the minimum starting salary upward in accordance with the years of related experience held by the successful candidate.
Do I have a motion?
So move.
Second.
Any discussion?
Amber, how did you come up with the $76,000 figure?
What I did was I took the starting salary the last time that we went through this process, and I applied the COLAs that were given to all positions in the county.
That was my question.
That's it? No other questions? Everybody in favor, say aye.
Aye.
Oh, we-
Aye.
A second?
You hear that?
All those in favor say aye.
Aye.
Thank you, Scott.
I'm sorry about that.
Okay. Information Technology Budget Amendment, Dennis Bolton. Good morning.
We'll be referring to this drawing that I have up on the screen for my request today. I come to you requesting that the board allocate $15,000 for the possible relocation of some fiber there at the corner of Glen Burnie and Martin Luther King Boulevard there by the Rite Aid. What's going on at this location right here is the state, DOT, is adding a turning lane to get more traffic out on Martin Luther King Boulevard. While the county's fiber, we have fiber that runs down this road, the blue mark that you see there runs between the college and the school board. And there are many entities that are using this particular section of fiber. What's causing this is there's a storm drain right here for the movement of water. And that has got to be completely dug up and relocated. Our fiber is in very close proximity to that and may be affected when they start this project. I'm not going to know until this week, as a contractor, ST Wooten is out there trying to evaluate what's going to have to happen here. My fear is if this fiber gets cut, it will require, a significant amount of money as far as my budget goes to get it repaired. And if it happens this week or next week, the board meeting is not until sometime later, and that could delay or either cause some downtime for the schools, the college, our sheriff's office, and various other agencies that are using this section of fiber. So I'd like the board to authorize up to $15,000 be utilized if we have to replace this section of fiber, depending on ST Wooten's findings that are coming up.
Okay. Do I have a motion?
So move.
Any discussion?
Mr. Chairman. County manager may want to jump in on this. I want to make sure I understand this. If we're concerned, okay, we're only concerned in case they cut it. If they cut it, then they're responsible. Is that not correct?
No.
Why?
Well, right-of-way agreements. So basically, we're
But, I
putting
mean,
our.
they're not asking to have they asked us to move it? I don't know why I'm saying it, because I heard if Wooten gets in there and digs up the manhole and cuts it. So has somebody made a requirement of us to relocate it, to move it?
I think what Dennis left out was there may be a need to relocate it
Yes.
once they get in there and begin working on the storm drainage. If that's the case, then we would be responsible for that because we're in the right of way.
I understand that portion. I understand that, but I didn't hear that. I heard,
I don't think he said that.
I didn't state that like you
I
did.
think, George, that it's one of these things that Commissioner Liner, that there's a lot of unknowns here on how they're gonna do this. Until they start moving a little dirt, they may show up to Dennis's door and say, you need to move
You
this
gotta move
3
it.
feet, and then we would have I mean, this is the cost to move it, basically, the 15,000. Could come in less, could come in halfway.
Zero.
I mean, it's hard to say at this point.
Yeah.
Well, I
They
just
might-
wanted to make sure, because if, I understand the state has the right to ask us to move it, because we're in their right of way.
Yes.
I wholeheartedly understand that, but I did not hear that they got in there and took that manhole out and they cut it. Well, they say it's going and they cut it, that's theirs, the repair.
Yeah, they might go around it.
Yeah, okay, if you're doing it from that purpose, that they've asked us to relocate it.
Yes.
Once they come in, fine.
They
My
may-
hope is that we don't expend any money.
Right.
I
Yes.
mean, but again, Dennis is just worried that we got it 3 or 5 Mondays in this month, so there's an extra week here that we won't see you.
Right.
It's gonna happen during this time, so we
They're,
need to be.
they're gonna move, they may move quickly on, I'm afraid that I might get caught here.
Okay.
Okay. Any other questions?
Dennis, I think you should note that you did have money budgeted this year for a relocation for the Slocum Creek project.
That is correct.
Which may or may not have to be relocated, so we may actually have a savings there in case this pops up. It may be one of those things we're able to trade off once we know a little bit more, but just to be extra cautious, we're gonna keep the Slocum money in, add this if needed, and then hopefully in the end we'll wash out, not spending as much.
Mr. Chair, I think one thing the community needs to be aware of, with everything that's going on with DOT, I think the municipalities, and especially the counties, realize it, but I don't think the general public realizes that a lot of our stuff is in their right-of-ways.
That is
And
correct.
it's our responsibility if they decide to relocate or move. We've used their property, but the equipment in it is ours. And if all the construction that's going on, then it's our responsibility to take it out of there. and
Their
move it on.
request, that is correct.
Commissioner Leiter, I think one thing, you bring up a good point, wait till they get to James City.
Yes.
To start working on Highway 70. I mean, everything in the world runs along that corridor, and when they're, you know, so I'm just, in the future, we're gonna have to really talk about that.
Yeah.
They are good to work with, though, they do
I
communicate well.
understand
so-
that, but I don't think the general public is well aware of what we have,
How much infrastructure
Is-
we do
is
have
in
along these right-of-ways.
the right-of-ways.
We have a lot. Yes, sir.
Madam Clerk, would you call the roll?
Commissioner Jones?
Yes.
Commissioner Liner?
Yes.
Commissioner McCabe?
Yes.
Commissioner Sampson?
Yes.
Commissioner Tyson? Vice Chairman Dacy?
Yes.
Chairman Mark?
Yes. Thank you.
Thank you.
Okay, next is appointments. Pending appointments on the Adult Care Advisory Committee. I believe we were not able to have that appointment with that committee, CCC, due to the storm we had, so I'll have to rearrange that appointment. Craven County Health Board. We have a term expiring Ronald Preston, and we have an application on file for Ronald May.
Mr. Chairman, Commissioner Tyson reached out to Carolina East, and from that, he was able to get Mr. Ronald May, who has agreed to serve.
Okay, so we'll do that appointment by acclamation. Cove City, Craven County Library Board.
Mr. Chairman, I asked that Ms. Patricia Wood be reappointed.
Okay, by acclamation. Upcoming appointments for February are Craven Agent Planning Board, Craven Community Child Protection Team, and in March, we've got the Craven Agent Planning Board again, Craven Community Child Protection Team, and Craven Clean Sweep Committee. And the next on the agenda would be the County Attorney's Report.
Good morning.
Good morning.
Morning.
I have 4 matters to present this morning. The first is an initial offer to purchase real property located at 509 Broad Street that the county has received in the amount of $120,000, and this is the building formerly used to house a probation office. As is usual, should the county accept this offer, the property would then be advertised for upset bids. And once no further upset bids were received, the county would have the option of accepting or rejecting ultimately the offer. I'd like to get the county manager's input and thoughts on the purchase price before we move any further, if the board doesn't mind.
Thanks, Aaron. Commissioners, last time, I believe it was about 2 months ago, you received an offer of $108,000 and some change. The board chose not to take action on that offer. The activity flourished with the property. Mr. Hodges probably showed it a dozen times after that. We were suspecting an offer was coming. This was one that we felt was coming at 120. I think you're getting, I mean, like last time, I have no idea what the magic number is. My belief is if you start the bidding process, because this will be the upset bid process, I think there's other bidders out there that are waiting for you to start that. Now, of course, there's no guarantees in this world. You know, I've thought a lot about what's the right number. I think you're in that 120 to 160 range that I'd already always identified, excuse me, of what I thought the value is. Of course, there are people that are a lot more knowledgeable about this than me. One of them sits on the end of the board down there. But I think you're at a point where if you want to start the process, you're going to see some activity. And remember, even if you accept this, go through that, you have no upset bids, you still have the opportunity to not accept this one more time if you want to take a peek at what's out there. So I'll leave it at that.
Okay.
We have a question.
Yes.
So you're saying continue with this and let it go to upset bids, and then bring it back at that point to see whether we accept it or put it back on the street or?
It's got to come back to you anyway.
Okay.
Is that a motion?
Yes, a motion.
Second that motion.
All in favor, say aye.
Aye.
Thank you. The second matter is an offer that the county and the city of New Bern have received regarding property located at 111 Williams Street. The offer to purchase this property is for $1,000. This is property acquired through a tax foreclosure. The total taxes and costs that were foreclosed upon were $13,006.94. That's a little higher than normal, and the reason being that the city of New Bern had significant abatement liens on the property. The current tax value of the property is $4,000. And as usual, should the county accept this offer, it will go into upset bids. And lastly, I'll just point out that in the event we move forward and $1,000 is ultimately the price that is paid, it's estimated that the county will receive approximately $530 of the proceeds from the sale.
Have a motion?
So moved.
Second.
All in favor, say aye.
Aye.
Nays? The ayes have it.
Thank you. Thirdly, similar to the last item, this is an offer to purchase the county received for property located at 1112 Grace Street. This offer is also for $1,000. The total taxes and costs foreclosed upon were $10,719.82. Similarly, that number is a little high due to City of New Bern abatement liens that existed on the property. Current tax value of this property is also $4,000. And it's estimated that if the $1,000 is ultimately the purchase price, the county will receive roughly $540 from the proceeds.
Okay, do I have a motion?
So moved.
Second.
All in favor, say aye.
Aye.
Nays? The ayes have it.
The final matter is concerning technical adjustments to amend the animal control ordinance. At the January 2nd, 2018 regular session, the board in attendance approved unanimously a technical correction to that ordinance. However, because Commissioner Mark was not present, another vote is needed. As the board recalls, we needed a unanimous vote for an initial passing. At this point, we only need a simple majority. And just to refresh your recollections on what we were doing with that ordinance, the ordinance has historically read that it is unlawful for any person to engage in one or more of the following acts. One of those acts is a requirement that we provide adequate food to animals. So we were prohibiting people from providing adequate food to animals, which was obviously not the intent. So now it will read, it's unlawful for any person to violate any of the following provisions.
Okay. Have a motion?
So moved.
Second.
All in favor, say aye.
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 That's all I have. Thank you.
Thank you. County Managers Report.
Yes, sir. Thank you for the opportunity to speak with you. I don't think Aaron's that tall, but I'm gonna pull it down a little bit. Couple things I wanted to make you aware of. Got some late breaking news on Friday. There's gonna be some meetings today over in James City on the new project, some public meetings. They will be two different meetings today. We got this information from our MPO. There will be one from 3 to 4:30. It's a local business meeting, be held at Cornerstone Assembly Church. And then again at 6 p.m. tonight to 7:30 will be the local residents meeting at the same venue, Cornerstone Assembly Church, 2304 US Highway 70, New Bern, North Carolina. I'm fairly certain if you're going toward Havelock, that's on the left side of the road.
I thought the business meeting was at 6.
The local business meeting's from 3 to
Oh,
4:30.
3 to 4:30, okay.
And you'll have there, today, you'll have Jametta Posey, who is the consultant that's worked with the DOT on some of the design. She's sort of the on-the-ground, boots-on-the-ground type consultant. You'll have a representative from DOT who's the project manager. And you also have Craig Young with Three Oaks Engineering, who has done the design on this project. So you're going to have the team there. This is simply an update for the public on where it's going. If you remember back a couple months ago, I had received a briefing that everything is not only on schedule, but maybe a little bit ahead. We've seen a tremendous amount of surveying work done over the last few months. There's been 2 new interchanges on the far eastern end, both at Taberna and Carolina Colors. So this project's moving forward. If you want more information, you want the full briefing, I would recommend you go tonight. If you know people who are interested in this project, we'd also like you to encourage them to go. I'm sorry for the short notice, but I did just receive this Friday. Commissioner Tyson, I left you a copy. I didn't know if you wanted to share that on Facebook or something with your constituents since it's in your district. February 19th would be our normal day meeting. It'd be 1 month from today, or 5 weeks from today. There's 2 things that we'd like to happen other than the normal meeting. One would be a work session immediately following our regular meeting to go over a couple items. One, the chairman, vice chairman Dacey, myself, Scott Harrelson, went back to Onslow County last week. They have shared with us some information on that the detox center project. We would like to have some of the Onslow County folks come up and brief the full board so you're all on the same page with that. They are going to be looking for a decision from us sometime in March. Unfortunately, we did come in late to the process, and they have moved further. They're giving us a little bit of time to consider it because they understand there's a lot to think about there. I'm working with Craig, our finance director, on ways we can fund it. I think there's some good news there. I don't want to share it quite yet till I'm more comfortable with it, but I think there's some good news with that.
We have to
Second,
be back to them by March 13th.
March 13th. So we figured if we get it in February 19th, that would allow a decision by this board at the first March meeting in 2018. Second thing on that day, Dr. Doyle has called me last week. She has some information she'd like to share with you regarding legislation affecting class size. She would like to do a joint meeting between the Board of Education and the county commissioners to brief everybody one time, and I thought that was a good idea. I don't know that there's other items, but we may find some between now and then. We'd like to have a joint lunch at 12 that day at the convention center. I've agreed to host it. And I just wanted to see, mainly what I'm concerned about today is, can you commit from 8:30 to about 1:30 that day? And if so, I'll go ahead and schedule these with the chairman and proceed. So anybody can't be here that day.
To put a date.
What date was that?
I got you.
19th.
February 19th. Okay, I'm not hearing anybody say no. Okay. Wanted to talk a little bit about the audit. I certainly wanted Lou to be able to give his presentation from my side. Certainly Medicaid is a complicated program. There's a lot of moving parts. There's a lot of things that we have to do for the federal and state government. It is a mandated service that we will provide, and we do that. What I want to tell you what I've done, even though it's written in the book, is I've worked with our DSS director, our assistant DSS director, our finance person at DSS, and also our program manager to ensure that we're continuing to focus on things like training. When we get a new employee in, we put them through a training protocol, and they learned these processes. I got a good feeling that we're doing it, but I certainly want to review that process. The second thing is, part of the program we started 2 budgets ago was an oversight program. You agreed to hire a couple additional DSS employees, income maintenance, and we now have those as sort of looking over the shoulder. As a person's new into the job, we're checking behind on their work, making sure those forms. Basically, we're doing what Lou's doing on a much more aggressive scale, right on scene with the folks. And certainly, I've asked that the supervisors have more evaluations of employees' work. Here's what the problem is now. We don't have the luxury of having people who can't complete the job, stay on the job a long time to figure that out. So we've got to determine whether, and this board knows that this is the time you hear from me, there's a lot of hard decisions that we have to make. One of the considerations is, I think the public misses, is sometimes we have to try to get back because people are counting on us. And I can tell you that Monday morning when we opened up on a delay at 11, things were not perfect. I will tell you that. The roads were still slick, the parking lots were not in good shape, but we have folks that needed to come in and have service to survive. I mean, that's what county government does. A lot of times, people rely on us for food, warmth, shelter, and there's certainly things that we have to strive to get back. We did also have a deadline, which you're aware of, I shared with you, and I want to make sure we clarify it on the record today, is that our tax due date was the Friday that we missed for inclement weather without penalty. I talked to each of you individually that night and got a voice yes from you. Mr. Chairman, I would like for you to take a vote today, if you wouldn't mind, to extend the tax date from January the 5th to January 8th to have it on the record. While the general statute says that it's perfectly acceptable for me to get an acknowledgement from each of you, I think it's important that we put on the record to avoid any questions. So I will leave that to you if you'd like to make that.
Okay. Could you make a motion?
Make that motion.
I'll second it.
All in favor, say aye.
Aye.
Thank you. As we look forward to the next storm, Mr. Hodges and I have already talked today. We will certainly use precaution. One of the things that's challenging for us is transportation. We got buses on the road at 5 in the morning from Trenton to Bayboro, and we have to put that in consideration. We will do that again today, and we will certainly try to take everybody's safety in hand as we do that. But I can tell you in the budget coming up, it's sort of a, I don't want to call it a knee-jerk reaction, but you see things that happen during a storm that you don't realize till you're in the storm. And there are things that I'd like to address in this upcoming budget that we need to work on. And certainly have had some conversations, I want to make the board aware, with DOT and the governor's office about their response. I think DOT did a great job with the materials they had. The problem is they didn't have enough materials and enough equipment to take that. And to be perfectly honest, I have the same reason why the parking lots look like the road, is because it was a different type of storm. It wasn't a pure snow event. There was a layer of ice. When you scrape the snow off, you had this much ice and sleet underneath that you really couldn't do much with, unless you had a blowtorch, which we didn't have a lot of those. So, but I'm available for questions that the board should have, any of your comments moving forward on that.
The only thing I would like to say is I want to thank you and Gene for getting out there and traveling the roads and keeping me informed of what was going on. I think that was very good.
Thank you, sir. Appreciate that. All right, with that, that's all my comments.
Okay. Commissioners' reports. Commissioner Tyson.
Mr. Chairman, I have no report today.
Okay. Commissioner Jones.
Mr. Chairman, thank you. I would just make an additional comment of what the county manager stated about the weather condition and roads with DOT. County manager and several commissioners did reach out to the governor's office in talking with Mary Jo Alco, who is the governor's assistant for this region, and shared with them our concerns about the roads and so forth. And I appreciate them listening to us and trying to take into consideration our concerns. I think it was widespread, again, unexpected. In saying that also, I talked with the county manager about this. I've had a lot of calls about water lines being busted at people's homes and wanting to know exactly what the county was going to do about it. In our ordinance, as we have with the water department, we give one opportunity for folks to submit a receipt showing that they did do something to fix their water lines, et cetera. And we do give a one-time forgiveness over a 12-month period. And so if folks have high water bills and they can show proof that they have fixed it as a result of a receipt, they will for one time. For the next 12 months, that can be forgiven. And so that is the information that we try to pass along, and I've tried to pass along to a number of folks. The only other thing I will say, I did have the opportunity last week, went to Tennessee, attended a national convention for Farm Bureau, and had the opportunity to see our Secretary of Agriculture, Sonny Perdue, and also President Trump came and spoke to our delegation. I was encouraged by some of the things that were said about rural America, about agriculture, and I appreciate the comments that were given. And I hope that our Congress will join in and try to support those efforts. So that's all I have, Mr. Chairman.
Thank you. Commissioner Weiner.
General public out there tonight at 7 o'clock at Roger Bell. There'll be a community meeting on the new school year for Roger Bell. So all of those attending school at Roger Bell, please show up to have your comments or hear what is going on. For myself personally, it's not been a good 2 weeks. I've buried 5 close friends in the last 2 weeks. One of them was a father figure to me, who is a World War II vet with 4 Distinguished Service Cross, 76 combat missions, shot down 3 times, and was just a Southern gentleman, born right here in New Bern, Pollock Street. Lived here all of his life until I was in the service, come back here. And that generation is slowly thinning out, and you cannot thank that group of people enough for what they went through and what they've done. Other than that, let's move on.
Okay.
Mr. Chair, I don't have anything. One question, George, is that tonight or tomorrow night?
Tonight,
I thought tomorrow night. Be sure? You sure they're on Wednesday?
I'll let you know after the meeting. I'll let you know.
Commissioner Sampson?
Well, I'd like to thank the Lord that it was a blessing in this county that we didn't have any more accident than we had with all that sheet of ice under that snow. I didn't get out as much as I usually get out because you couldn't hardly walk through that snow on ice. And you couldn't hardly get anything out. I had my water line to bust. But I was thankful that I was able to get it back up. But everything in the house stayed frozen for about 2 or 3 days. So it's a blessing that the Lord didn't let it be no worse than it was. And I can say people worked pretty close together during that storm. I would just hope that people could work like that all the time together rather than wait for the storm to come. People so helpful, trying to help each other. Now, I remember seeing a storm similar to that. I saw a storm one time that was so cold that it froze the oil, the kerosene that was in the kerosene line from the tank, and froze it in the carburetor. So, but I never did see this much ice under the snow. But it was a blessing that we didn't have any more accident than we had. It wasn't because we was that smart, because the goodness of the Lord. A lot of people didn't get out. I know my wife didn't get out in this kind of weather. A lot more people didn't get out in that kind of weather. But I thank the Lord that it was well as it was. I thank the public for helping look out for other people who were having the same problem. And I thank the Lord for the county, how they was able to get out in the community and do things that they did because it was a bad time out there, but somebody had to get out there and help somebody else, and that's what it's all about. And I just hope people could be like this at all times, be careful to look out for those who's in trouble, like senior citizens and people, sick people, and get sick and had to go to hospital. This was a bad time, had to go to hospital, because there was ice everywhere. But you had to go, you had to go. And I'm thankful that everything turned out pretty good. I didn't see that many accidents in the city of New Bern. Didn't hear about that many accidents in the state. So that was another blessing. Even though as bad as it was, this year I didn't see as many accidents that I have seen when it was less snow and ice on the ground. And I'm thankful that everything turned out as well as it did. I just hope people could learn to do this before the storm comes. Then we'll have plenty of practice and we'll be prepared. But I'm still praying that this happens. That's all I have.
Commissioner Dacey.
Good morning. Thank you very much for your indulgence in allowing me to do the meeting from the car here today. First of all, Allies for Cherry Point met last week, and all things are going well with that organization. We're going to be planning another fundraiser for sometime in April, so get your checkbooks ready, folks. It will be the event that we hold in the springtime in New Bern, and it'll be along the waterfront, and I'll, of course, get you more information on that. The Board of Allies for Cherry Point also did hear from the school superintendent's office, and we approved some modest funding to support those families who've got children, and one of the parents is going to be deployed. And we've made some money available for packages that would help those children get through that deployment process. Also last week, the East Carolina Council of Governments met and had our annual meeting where we sworn new board members, that sort of thing. Everything is going along well with that organization. Greg Singleton from our reentry program in Craven and Pamlico counties made a presentation to the group and tried to encourage each of the municipalities and the counties that are within ECC to engage in reentry programs themselves. Many of you folks know, and what we learned today, the employment numbers are getting tighter all the time. And so anytime we've got an able-bodied individual that is going to be out there in society that can work, we need to make certain that they're well-trained and able to take on those jobs. I guess that's it, Mr. Chairman. Thank you very much.
Okay, thank you. You know, I would just like to talk about the storm for a moment from the standpoint of new people who have moved to Craven County, and warn them that when the governor puts out an emergency, every vehicle off the road, and only those vehicles that are meant to be out there, such as police, fire, and transportation department, that we adhere to it. I had received many phone calls and emails from people that were kind of exasperated about the snowstorm. Many didn't realize that the county has nothing to do with snow removal or any of the roads in the county. The State Department is in charge of all the roads, State Department of Transportation. They do the highways as the first thing, and the secondary roads are the second to be done. In many cases, in this particular storm, because of the extreme cold weather, they had to go back out because of refreezing of the highways and weren't able to get to the secondary roads. In addition, I want to thank Commissioner Jones, Commissioner Liner for getting to the governor and mentioning to him that some of the people that were brought in, we didn't get many of them to help us out. But I think that when any time we have a hurricane or a snowstorm in Craven County, that people have to understand that the roads are a dangerous area to travel. And therefore, they should have at least 5 days of food, water, and medicines in their home in an event such as that. And I think they will find it a lot easier to manage the storms.
That's right.
Thank you very much.
Chairman, I have one more thing. I'd just like say that we celebrated Dr. King's death over the weekend, and we had a great number of people to come out, even in the bad weather. We had quite a few people come out, still recognizing Dr. King as a force when he was living to try to help bring people together. And I'm just thankful that people still remember what happened during his lifetime, how he sacrificed himself, not to help certain people, but to help everyone. And I think he did an outstanding job, and we have a lot of people doing an outstanding job in bringing people together, because we realize that the people together, we can conquer anything. All right, thanks.
Okay. I second that, Commissioner Sampson. I think that Dr. King did a lot of good work, and I'm glad you mentioned that. Other than that, I would ask for adjournment.
Adjourn.
We are adjourned.